It is January, and many of us trying to lose a few pounds, right? But the truth is there is an obesity epidemic going on in our country, and it affects so much more than the way you look. Dr. Lilliam Chiques is here with the Watson Clinic. I'm so glad we're talking about this today, Doctor. How are you today, first off?
I'm doing great, thank you.
Thank you for being here. It's in the headlines. If you watch TV, every commercial, it feels like, the GLP-1s, the weight loss medicine. Doctor, as someone who is a head of an obesity and weight loss clinic, what are your thoughts?
I think it's a very exciting time that we are living through. There's an obesity epidemic. 75% of people in the United States are either overweight or obese. And it's for a multitude of factors, but the new medications are offering hope that we are going to be able to get a handle of this. They are highly effective, and more are on their way in.
Let's talk about why there is this epidemic. I mean, it's a strong word, but it's a word I know that you feel is appropriate. Why do you think there is an obesity epidemic?
I think it's a combination of factors. I think in part it's a result of technological changes in the way that we eat, the food science, the way it has advanced our foods. We have access to foods that taste really, really good.
Yeah.
But they also have a lot of calories. They're very dense nutritionally, and when you have access to that, people tend then to bring in more calories than they need, and that's one. Then the other side of it is that we live in a world where here in the United States, we depend on our cars. There's no way that I can get to work walking safely. It would take me too long,
yeah,
and I may die on the way to work.
Yeah.
So as a result, we spend a lot of our time sitting, either driving or just in our offices. In terms of entertaining ourselves, we rely more on our gadgets, and that means less activity as well. So that combination of things, more calories and less activity, that is probably the main reason that we have an obesity epidemic.
I just saw an interview that Oprah gave, and she talked about how mentally she's so much happier because she's able to recognize obesity and weight management as an actual disease, as something that a medical professional can now give help for. And getting back to these new medications that you are able to see, is that how the approach needs to change? It needs to change for everybody mentally, not just, Oprah for app. It needs to happen to everybody so that we can, take medicine. You have a disease, you take medicine. That's what it seems like we're finally there with weight management.
That's right. It's a disease of our environment, and ideally we could change our environment and have healthier food. And I think there is a drive to do that.
Yeah.
And ideally we could incorporate activity into our daily life. But the way things stand, when you are overweight or obese, you are sick. You're sick not just from being overweight and obese, but because you develop diabetes, you develop hypertension, you develop sleep apnea, and those are things that have real consequences to your health.
And do you think, you hear sometimes in the headlines the negative effects of these medicines? You were telling me off camera the positive outweighs any potential negative or side effects that people would have with any kind of medication prescribed, correct?
That is totally right, yes.
And so moving forward, is it something that people should go out, and when should they reach out to someone like yourself?
I think if you are overweight or obese, if you have chronic medical conditions that are associated with your weight, like high blood pressure or diabetes, those are things that you need to discuss with your doctor. Not everybody, to be clear, not everybody needs these medications, but
right.
I think a large percentage of our population would benefit from considering them.
Well, I am so glad we were able to have the conversation with you. Like I said, you are head of the weight management at the Watson Clinic, and just to be able to have this conversation and hopefully help some people, I know is everybody's goal. We, in fact, want to make sure and share the contact information for the Watson Clinic if you've got any questions or want to learn more as well.